How's it going, guys? Medium difficulty question for gastro, steps 1 and 2. So we have a 25-year-old man, barium enema is shown, Qbank elevated, and I intentionally gave you a very skeletal / vague vignette because I want to test your radiology here. As I've talked about in other YouTube clips, no, the USMLE does not expect you to be a radiology expert, but this barium enema, exceedingly high yield and pass level. We're looking at ulcerative colitis. You can see the lead pipe appearance, loss of haustra. You see the colon here, even if you have no idea what you're looking at. You see the colon here is very smooth in appearance on the right of the image. The descending colon, the left side of the patient. See how it's very smooth? That's lead pipe. In contrast, look at the right side of the patient, the left side of the image here. You see how, if you try to observe it the best you can, see how there are some haustra? There are some indentations in the colon here. So it's characteristic for UC, pass level step 1, the loss of haustra, that's ulcerative colitis, okay, lead pipe appearance on barium. Crohn's disease, in contrast, would be string sign. You'd see narrowings of the colon, actually mouth to anus with Crohn's. Sometimes you can have negative barium enema. But the point is, let's look through the answers. What's most likely to be seen in this patient with UC? Choice A, decreased stool pH, wrong fucking answer. Now, I just want to point out, some of you might get hyper pedantic and try to rationalize choice A and choice B, both wrong fucking answers. Okay, you say, well, technically, what you have to do is look at the answer choices and arrive at a best answer. Decreased stool pH in this context for USMLE questions refers to lactose intolerance, lactase deficiency. They like that. Decreased stool pH is just characteristic. If you can't digest / absorb lactose, then you can get a fermentation process, bacterial process acting on the disaccharide in the bowel, and you can get decreased stool pH as a result. Wrong fucking answer. Choice B, as I just said, wrong fucking answer. Increased stool lipid protein content. Okay, I mean, in patients with advanced disease, maybe there's a degree of malabsorption, but it's not characteristic of UC. It's not the best answer here. So this could refer to patients with chronic pancreatic insufficiency. So pancreatectomy, chronic pancreatitis in an alcoholic, where chronic pancreatitis, there's no pain. You have normal / low pancreatic enzymes. I've made clips on it. Think of chronic pancreatitis as cirrhosis, but of the pancreas. So we have decreased lipases and proteases coming from the pancreas. It will present as a 44-year-old alcoholic who has steatorrhea. That's it. Okay, they can tell you there's increased protein lipid content in the stool. That's chronic pancreatitis. Wrong fucking answer. Choice C, macrophages lamina propria, wrong fucking answer. Very buzzy descriptor for Whipple disease caused by bacterium Trophorima whipple, however the hell you say it. So 100% of questions, they're going to say PAS positive macrophages in the lamina propria. I didn't even write PAS here. Okay, so it's just, I mean, I don't really know what to tell you. It's a buzzy finding, but Whipple disease, bacterial infection, you can get miscellaneous findings. Apart from malabsorptive disease, you can get arthritis, you can get renal, even cardiac issues. It's not a high yield condition, but it's very buzzy. Some of you have heard of Whipple disease before. You say, oh yeah, PAS positive macrophages in the lamina propria. Wrong fucking answer. Choice D, non-caseating granulomas and muscularis propria, wrong fucking answer, refers to Crohn. You can get the non-caseating granulomas in all of the layers of the bowel: mucosa, submucosa, muscularis propria, serosa / adventitia. You can get, it's transmural Crohn disease. But one of the highest yield points, pass level points for USMLE is, Crohn on histology, you can get non-caseating granulomas. UC, you don't get them. Okay, so you're left with choice C, correct answer. Very weird answer. You say, that sounds like a left field type of, like, what's even going on here? Okay, there's two ways to answer this question. Number one is we eliminated to get there. Number two, holy shit, I told you P-ANK is positive. Now, isn't that very unusual? Some of you are like, wait, how does that even relate? Because P-ANK relates to the vasculitides, fancy word, plural for vasculitis, Churg-Strauss, eosinophilic granulomatosis cholangitis, could have heard of microscopic cholangitis. So you've heard of P-ANK, many of you, with regard to those vasculitis conditions, but holy shit, P-ANK is positive in 60 to 80% of patients with primary sclerosing cholangitis, one of the highest yield extraintestinal manifestations of UC. Okay, so primary sclerosing cholangitis, you can get a beaded, if you do a cholangiogram, you can get a beaded or pearl-like appearance of the bile ducts. Okay, so the USMLE doesn't have to tell you P-ANK is positive. I threw that in there to make it more obvious for those of you who raise an eyebrow to choice C. Okay, so primary sclerosing cholangitis, you can get increased serum, you will have increased serum ALP and direct bilirubin. Okay, so high yield for USMLE, primary sclerosing cholangitis with ulcerative colitis, you get P-ANK positivity. You know the deal. Until you make more content, like my stuff, scrum. Appreciate your time. That's it.